Hello, thank you for the opportunity to be with you today. The purpose of this session is to receive your feedback on this global health and nutrition sector update and your insight on this question. How can World Vision leverage our new and expanded relationships and ways of working during the pandemic to best achieve success in the future and communicate our success more widely? It's great to meet with this committee again. The last time I presented to you was shortly before the beginning of the COVID-19 pandemic back in November 2019. We've had a bit of a wild ride in health and nutrition since that time, and I believe that despite troubling setbacks in children's health and nutrition globally over the last 2 years, by working with our colleagues in other sectors and discerning God's call, we worked in ways that helped save a lot of lives around the world and help preserve and improve the well-being of children. This update will focus mainly on World Vision's response to the COVID-19 pandemic and provide an update on ways we have increased the 4 I's: impact, influence, innovation, and income. Based on World Vision's considerable experience responding to pandemics in the past, such as the HIV, Zika, and Ebola pandemics, we were ready for this storm, and we were able to work with other World Vision teams to quickly create needed documents, tools, and mechanisms for our work. For example, we created health and nutrition policy and programmatic and advocacy guidance for the World Vision COVID-19 response to confront the crisis, and an organizational capacity statement and policy positioning from a faith perspective. We created a core programmatic guidance document for field offices, adapted our core project models, developed advocacy guidance for field offices, and published World Vision's key policy positions related to COVID-19, the aftershocks reports, and most of the other COVID-19 related publications. We scaled up implementation of the barrier analysis formative research methodology to understand regular mask use and better understand vaccine acceptance, leading to multiple publications. We successfully nominated staff to represent civil society on the COVAX Facility Demand Side Working Group and the ACT-A Accelerator, which both provided World Vision advanced information on global planning and investments and the opportunity to demonstrate leadership and our key strength areas of risk communication, community mobilization, and demand creation. We also proactively engaged partners, including the WHO, UNICEF, Gavi, World Food Program, and the World Economic Forum, and oriented them on World Vision's capacity. In terms of the first I, impact, we have seen some excellent gains. The 2020 Global Impact Scorecard demonstrated significant impact on all of our Global Impact Scorecard indicators that were measured in multiple countries. We saw a 23% increase in care seeking for sick children, which wasn't easy during the pandemic, of course. We achieved an 11% increase in exclusive breastfeeding to 6 months of age, which has a major impact on child deaths. And we also saw a significant reduction in malnutrition by 2.3 percentage points. That may not sound like much, but this is more than 6 times greater than the global trend over the past 2 decades. All 3 of these outcomes have a significant impact on child health and survival, despite the fact that the inline surveys being conducted were being done so during the worst pandemic to hit the world for many decades. We also reached more than 2 million people with vaccine messaging, partly through the 38,000 faith leaders who were trained to promote vaccine acceptance. We are now building on that by co-designing with UNICEF a 6-country scale-up of the Channels of Hope model for COVID-19. Between 2016 and 2020, we distributed over 54 million insecticide-treated bed nets, and estimate that in 2021 alone, we saved over 26,000 young children's lives through those nets. We have also greatly increased our influence globally, leading to strong effects on our public perception and positioning World Vision as a global leader in health and nutrition. For example, many of our COVID-19 tools and documents have been picked up by the WHO and UNICEF and included in their response recommendations globally, such as our barrier analysis tool and our Channels of Hope, Citizen Voice in Action, and Community Health Worker models. This has helped to deepen our reputation of expertise in formative research, social and behavioral change, faith actor engagement, social accountability, community mobilization, and partner coordination, which really well positions us for grants. We have substantially increased publication of World Vision position papers and scientific research. The Aftershocks series has been broadly referenced by partners, as has our barrier analysis peer-reviewed publications. Currently, Andrew is a member of the high-level panel of wasting elimination with the principals of the aforementioned agencies and others. And with the World Health Organization, we co-led 2 multiple webinar series focused on the role of faith actors in pandemic response and supported development of the new faith sector strategy. One thing I'm most excited about concerns the innovations that we are developing and testing to save children's lives and improve their well-being at low cost. We've recently submitted for publication the highly promising and cost-effective results in child protection and WASH in Ghana from our nurturing care group model. This had remarkable effects on reducing parents hitting and abusing their children. We've presented out to global groups on this research, such as the WHO, the International Society for Prevention of Child Abuse and Neglect, and others. And we also created new NCG guidance so that this model can now be used to integrate our work in all 5 sectors plus faith and development. This model was actually featured in several successful important Gavi and government grants. Anytime you have to draw blood to tell if a child has a disease or a condition, it limits how much screening can be done. But wonder if we could teach our 184,000 community health workers to use a simple device that uses light to tell if a child has anemia, and they can also be used to measure how rapidly they are breathing, a sign of pneumonia. That's what we're testing in Kenya. Right now, we're only treating about 1 in 5 children who have the most deadly form of malnutrition, wasting. But what if we could teach parents to use a simple MUAC measuring strip to boost the portion of children who are screened and that get into treatment earlier? That's what we're researching in South Sudan, and it is resulting in more children being screened, getting then into treatment earlier, and lowering the cost of treatment. And in Mozambique, we're also studying how giving adolescent girls multiple micronutrient supplements can affect them and their future children. We're also studying the health, nutrition, and other impacts of child marriage, comparing outcomes in girls who marry early to those in girls who marry after they are 18. We're doing this in collaboration with the advocacy and child protection teams. These research initiatives and other presentations on our work have led to new and expanded partnerships with Gavi, Royal DSM, the Micronutrient Forum, Kirk Humanitarian, Vitamin Angels, Philips, Unilever, Merck, and Pfizer. Lastly, but definitely not least, we need to ensure that World Vision has the funding to scale up these innovations and cost-effective project models. Before the pandemic, we had a very low-level relationship with Gavi, the Global Vaccine Alliance. Given our pre-positioning work with Gavi since the start of the pandemic, they are now on the way to becoming a major global donor for World Vision. We have multiple grants with them in the pipeline, including a grant for $60 million USD via World Vision US to boost vaccination of children in the Sahel. We are working with Gavi and World Vision UK to move forward a test of our nurturing care groups and citizen voice and action models in the DRC to boost child vaccination. And we have a third grant, which will be channeled through WV Canada, where we'll lead a coalition of faith partners to increase COVID-19 vaccine acceptance in Uganda, DRC, and Nigeria, and possibly 2 other countries after that. And we're hoping to see the same thing happen with Gavi that has happened with the Global Fund, where our portfolio has now exceeded $1 billion in awards since 2003 and has doubled its portfolio size, currently at $365 million from the previous cycle. We do have a few risks and challenges ahead of us related to grants. For example, some World Vision offices neglect opportunities to leverage our health and nutrition global capacity and resource materials. We are working to increase our communications and mentoring of field office staff and simplifying and translating our materials into more languages as means to address this. Secondly, World Vision manages numerous partner relationships with responsibility for a $7 billion commitment within the Every Woman, Every Child movement and a $500 million commitment with Nutrition for Growth. Our current joint work plan with the WHO has 58 objectives. We direct our Global Fund portfolio of 18 grants in 14 countries. Some offices' partner and donor engagement is inconsistent and reactive rather than proactive. These offices are not engaging for advocacy or fundraising with key partners like the WHO, UNICEF, their own Minister of Health, and the Global Fund country coordinating mechanisms. As World Vision's grants portfolio increases, some offices may face constraints in their capacity to manage grant opportunities and comply with stringent requirements that, if breached, could lead to significant losses of funds and grantor loss of confidence in World Vision. Additional support from the Global Center teams has been planned that could help offices maximize their potential for securing and managing more health and nutrition funding effectively. We have 3 prayer requests. First, that the COVID-19 pandemic will end, that World Vision will contribute to reversing its broader effects on children, and that the world will take meaningful learning from the experience. Second, that every child survives and thrives in alignment with God's promises, and that from generation to generation, they have all the nutrients and services they need to protect their God-given right to optimal physical and mental development. And third, knowing the deep and lasting mental impacts of the world's multiple tragedies and traumas, from COVID-19 to Ukraine, we pray that every child will have access to competent mental health and psychosocial assistance to help them find God's persistent and infinite love and to feel safe. Thank you.